Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
I'm Dr. Santosh Kondekar. I'm working as Associate Professor of Pediatrics in TN Medical College and Eye Hospital, Mumbai. I also have my private consultation at Baikala as Akar Clinic.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
Seizure is a visible manifestation of a insult to the brain. Whenever there is a excitation into the cortex of the brain, it can initiate signals into some specific body part or in some specific pattern and which will manifest as a seizure. So what we see from outside as the movements of the eyes, hand or feet or maybe falling down or maybe jerkiness, all this is originating somewhere into the brain, into the cortex, into the neurons, and that is what is the manifestation of a seizure.
What is epilepsy?
Whenever a child or a person gets seizures repeatedly, or whenever the seizure has a chance of repeated occurrence due to some persistent pathology inside the brain, and this pathology can be visible or non-visible, structural or functional, it can be chemical or it can be electrical. All these pathologies in the brain can have a potential to cause repeated episodes of seizures in the same fashion or different fashion. So whenever seizures recur and they have potential to recur, we call it as epilepsy.
What are the different types of seizures and do they affect people differently?
See, epilepsy is a pattern of repeated seizures, and seizures are paroxysmal, means coming all of a sudden, stereotypical in a similar fashion. Abnormal electrical impulses from the brain giving command to the different body parts and making the manifestation of seizures. So, depending upon which part of the brain the excitation is coming from, the manifestations of the seizure differ. So accordingly, there have been many classifications in the past, but easiest to remember is whether the seizure is originating from one side or from both the sides. That means if one part of the body is initially involved and later on both the parts of the body are involved in the seizure, or only both the parts of the body are involved in seizure together. So we call it as seizures which are focal or bilateral. This is a common classification which helps us to understand which drug can be used for treatment of such seizures. Apart from this classification of focal or generalized, there are many other patterns by which a seizure can come. It can be, say, like absence seizure, it can be like a complex partial seizure, it can be a syndromic seizure, it can be myoclonic seizure, it can be jerks. Each one has a different way of manifesting. There are many parents who feel that, okay, it was only a twitch, it was only a jerk, it was not actually a seizure, he did not close his eyes, he did not open his eyes, he did not do movements. There was no further, nothing, everything is not must in a case of seizure. Even if a single manifestation of blinking can also be a seizure. Even an episode of laughing can also be a seizure. So it's only in the expert's hands when they face such situation in a case, they will decide whether to call this as a seizure or not, depend upon the manifestation of that event. So a seizure does not always mean that patient has to have movements of both the side, both the limbs, or having patient have to turn unconscious or having passing saliva or vomiting or stools. So, everything is not must. But definitely, more the events, more likely to be a strong seizure. Whatever it is, as long as there is a seizure, it needs to be tackled. If you do not tackle or treat and prevent the seizure, it may have potential to recur.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
Uh, Seizures can be resulting in due to any other insult to the brain. It can be an infection, it can be trauma, it can be toxin, it can be chemical. There can be no other reason when you call it idiopathic epilepsy. So causes for seizures or causes for epilepsy vary in the same fashion. If we find a cause, we call them as a secondary seizure or secondary epilepsy. But we do not find a cause, it is considered as a primary generalized epilepsy or just a seizure disorder. In pediatric practice, most of the times there is a cause, there is a reason for the seizure, and there is a reason for the epilepsy. And that's what the pediatric epilepsy group syndromes, diseases, and spectrum is totally vast compared to the adult epilepsies. Adult epilepsies we find easy to manage because they have only simple reasons like stroke, hemorrhages, or maybe tumor. But in pediatric, the range differs from tuberculosis to neurodegenerative disorders to syndromes of brain malformation. Also, two complex syndromic epilepsies like Lennox-Gastaut syndrome, West syndrome, or Dravet syndrome, or epileptic encephalopathies, amongst all this. Apart from that, the seizure disorder per se in pediatric population can also be due to metabolic causes like sugar is low, calcium is low, electrolytes are changing, and sometimes even the flashes of light or insomnia can precipitate a seizure disorder. So it's very, very, very crucial and important for us to know exactly what is the exact history in this child and what investigation we need to ask to get to the root etiology or cause of this epilepsy.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
If a person is behaving or maybe seen doing or seen acting or seen falling or seen moving abnormally, it's likely that there may be a possibility that it can still be a seizure. Sometimes seizures may not be seen, but somebody may be just lying down, somebody just falling. All these things can also be seizure. So it's very important for lay people to know that anything which is happening all of a sudden has potential to become a part of the epilepsy or a seizure. And if the child or if the person has history of past seizure, then definitely we are going to have high chances of calling it as epilepsy. So what a family person know, what a lay person should know is that what to take care when such things are happening. So whenever a person is having convulsion or seizure in front of you, what the family person has to know is that to prevent any other adverse complications occurring due to the seizure. So first most important thing is that whenever somebody is having a seizure, you just call for help. Do not throw water, do not throw any smell, or do not give any smell or touch any shoe to the nose or something. Do not do anything. Do not try to put finger into the patient's mouth if the mouth is stuck. If at all, do not try to even hold the patient or maybe stop the seizure by holding the child's or the patient's hand and feet. And that can even itself cause the injury to the child. Often, most of the time, you have to just let the seizure pass. Most of the seizures settle on its own in few seconds. If the seizure lasts for more than a minute or so, there is a likelihood that the saliva can be swallowed into the throat. So, maximum, you may just turn the child to one side if possible, and even if that is not possible, try to just put a hanky along the cheeks into the so that it will tackle the saliva. Our main aim is to prevent the aspiration. Most of the seizures settle on its own within just 1 to 3 months, and there are no heroics to be done for the parents. But if the seizure is lasting for beyond 1 to 2 minutes, definitely there are some emergency solutions like intranasal midazolam preparation, which will help curtail the duration and severity of the seizure if given as a nasal spray, and that can also be given if the spray is available in the pocket. If we are not having any such medications which are available for emergency use, whatever help you are called for. After 5 minutes, three to 5 minutes, if the seizure is not resolving, it's better to shift to the hospital so that this seizure, called as status epilepticus, may require further injectable solutions for its treatment and maybe further monitoring in the hospital along with the investigations and further treatment.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
See, any disease which will have a stigma when it is seen as abnormal into the society, not mixing into society. So stigmas are decided by the people's level of awareness, knowledge, and information, and their level of IQ. And stigma is also decided by what they had seen in the past and what this patient is. Every patient with epilepsy is not mentally retarded. Every patient with epilepsy is not going to get seizures every now and then. Every patient with epilepsy is not going to have behavioral issues. Every patient is not epilepsy is not going to have social issues. Every patient with epilepsy is not going to anger issues. But if a person had seen such issues in some patient, they will feel that, oh God, this is because of that, and he's going to have this, he's going to, so they keep on speculating, which actually is not material because most of the seizure patients, they're among us. They are exactly like us, and they are well controlled with the treatment, appropriate treatment with the appropriate dose and duration. So people have stigmas which will affect the social behavior or social impression of the person, social personality of the person, and they make it. It may be out of scare, it may be out of social feelings, or it may be out of their lack of knowledge. But the stigmas, that it can be damaging the person, it can be harmful. It, or maybe if you have marry a seizure person, he may not produce children. There people are many, they can call it as a curse of the god. There are many, many, many things. But what is most important thing is that all these are totally not related. They are all just hearsay things. So don't fall for hearsay things. Seizure people are us, and any of us can get seizure anytime. There's a 5% chance in the general population to have seizures, in any 5% of the population. So it doesn't mean that they will have to have some issue with them all the time. It's just a seizure, it needs to be tackled. In pediatric age group, they are definitely likely to develop febrile seizure, which is the commonest thing, which comes and goes. But if stigma is there, then people will always keep him living. Oh, he's different, and people will try to say, okay, fine, not to give such activities in the class, not to take him to the school, not to take him for outing. So all the stigmas will affect the quality of life of the child. So it's better that whenever anybody feels or talks about any such issues related to seizure disorders or epilepsy, it's better to brainwash them right now that yes, you need to understand more, learn more, and understand more how to have empathy and not just sympathy for these children, but also to have your own understanding changing, that they are as good as normal and there's nothing to have any stigma related to same thing.
Absolutely. Now let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
Okay. See, the triggers will may differ from a person to person, depend upon where this it is getting sensed. But actually, in pediatric age group, when you deal with febrile seizures, fever is a commonest trigger. In pediatric epilepsy, febrile seizures is one of the commonest cause of the fevers, febrile seizures. And when the fever is not tackled adequately, and the fever is not tackled promptly, or fever is not prevented, so child who's likely to have febrile seizures is going to get it precipitated. So one of the causes in pediatric age group is like fever, and more so in case of febrile epilepsy. Apart from that, the other things which might precipitate a seizure in a well-controlled child can be just a poor compliance, wrong dosage of the drugs, or maybe missing a dose. In addition to that, not eating good food, not sleeping adequately, and having hot flashes of light, they can also trigger the seizures. So, having a walk in a hot sunny afternoon can itself precipitate a trigger in such cases. In some children, the trigger can be because of some other stimulation, and they can be a different type of epilepsy.
Thank you so much, Doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
As I told you in the beginning, that whenever your patient is having seizure in front of you, first thing is do not panic. Second is always call for someone to help so that if anything is required, you may be able to help. Third thing is there are a lot many things not to do, and they are more important. They are more important for the safety, like not to show any onion, not to show any shoe to the nose, or not to put water into the face, not to put water into the mouth, not to hold the person who is having seizure, not to try to force him, not to shout, not to cry. It's all these things, they are going to not do good for the person. But a precautionary, what they have to do is that the patient should not aspirate his saliva into the respiratory tract. And for the same reason, just turning the patient to the side or semi-prone if possible, and putting a hanky in the angle of mouth so that the saliva will trickle through along that will help the seizure pass on its way. Second most important thing is what a person should be able to do in a case of epilepsy is that do not let it go away, or do not underestimate need for its investigation and treatment. So the person, to prevent the next episode of epilepsy, definitely they have to see to it that the person is taking adequate dosages, if possible, sometimes supervised, and there will be no lethargy in stopping the drugs, or maybe no lethargy in delaying the investigations, if at all, because there are some specific disorders which will require different drugs or specific drugs, and there are also specific disorders which may require many more than one anticonvulsant drugs. Now, that part of epilepsy is a refractory epilepsy. It doesn't mean that there's someone is wrong there. It's just because that person is having that specific type of epilepsy which might require more than one drugs.
Thank you so much, Doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course.
I will suggest parents to get into some epilepsy parent support groups, the patient support groups, so that when you are with the people who are known to have something, you'll share your all quality of life issues, your medication related issues, so that you can be at a better mental level, social, emotional, or maybe intellectual level to handle this case. Also, whenever you are going somewhere or whenever you are working at a place, it's important to let know the nearby people that you are suffering from epilepsy. So carrying a card saying that I am suffering from epilepsy, I am on so and so medicine, and if I get a seizure, just call this number, and if I get a seizure, you can give this medicine which is there in the pocket intranasally, and not to panic. So epilepsy care card with the identification will be very important for the parents if they or the patients when they carry it along with. So having a epilepsy control program, epilepsy prevention program, and epilepsy child management program even at the school level is also important. The school teacher should also be trained how to give the intranasal midazolam spray if a child develops a seizure at a moment of time with the parents consent definitely. Also, schools should also not create stigmas to the child to be separated in the training or classes or something, and the parents should also be not victimizing anyone just because the child had a seizure, and he is not to say that he is put to activity and he's definitely had this because of that. His parents should also open up. I always find a tendency parents to hide things from the schools, and schools have a tendency, once they notice this child is having problem, they try to stigmatize and try to keep him separate and not to mix with the other children or maybe not to others. So all these things can be diluted by making everyone more aware about their needs, about their uh, social presence, and maybe the need for preventing and treating the epilepsy.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.